Community oncology is at a crossroads.
It is up to us as leaders in healthcare
to continue providing our communities with the accessible, affordable, and effective care they have continued to rely on.
It is up to us as the leaders of our practices
to increase our efficiencies, become stronger advocates in Washington, and lead in healthcare reform.
It is up to us as the voice of independent community care to enact change.
We can make the difference for our patients.
I'm David Eagle from Lake Norman Oncology.
I'm Steve D'Amato from the Maine Center for Cancer Medicine.
I'm Dr. Ralph Boucher from the Center for Cancer and Blood Disorders, and I know why community counts.
Community oncology, in my opinion, is the most important facet of oncology care. Without community oncology, you really don't have practices that are able to change quickly and adapt to the ever-changing healthcare environment. And certainly there are operational, financial, and clinical domains of practice, so one must continually strive to put in efficiencies that improve patient care while not increasing the cost to the practice. Our patients have been so thrilled by the services that our practice provides. They're actually in tears when they talk to our clinicians when they come into the clinic on the weekend. And that's because of the issues that they've experienced in the hospital system and long wait times in the past are no longer an issue. They can be treated urgently, real time, and avoid those inconveniences. Our dispensing program has proven to be a huge success. We have a full adherence program in place. We do all of the patient education around oral oncolytics. We don't dispense 90 days of therapy on the first fill. We'll dispense 1 week. We call patients back within 72 hours to see how they're doing. We bring them back the following week to assess how they're doing with their prescriptions and to assess any early toxicities so we can make the appropriate adjustments to avoid drug waste that you see with specialty pharmacy. Patients really appreciate the services they can receive under one roof here in our community oncology practices. Not only do we provide the quality they need, we provide it at a lower cost. Without community oncology, patients are left with large systems to deal with that further reduces the personalization of care and decreases efficiencies and eliminates the ability to change rapidly in today's healthcare environment.
Influencing policy change in Washington can seem quite daunting. One of the most effective tools is to use the patient as their own advocate. As their constituents, the patients probably have much more influence on their legislators than the physicians do. So for the patient to write a letter, to email their representative, to go to the Hill and meet with the representative probably has the most impact of anything that could ever possibly help us in our fight, our battle to maintain community oncology. If the community setting continues to be weakened, access to care will suffer. We provide 85% of the care that these patients receive throughout the United States in the community, not at hospitals, not at tertiary care centers, not at universities, but in the community setting. Think what would happen if 85% of all patients suddenly had no community practices to provide the care. Where would they go? We believe that contacting our representatives makes a difference. We believe that we can put ourselves in touch with the legislators, can advocate for ourselves. We can send letters, we can send emails, we can make phone calls, we can invite them to the practice. They can see how we practice medicine. They can see the care we give our patients. They can see the illnesses that we treat. They can see the impact that those illnesses have on our patients.
I think the community setting provides tremendous value for cancer patients. It was really the community oncology model that over the last 3 decades moved cancer care from large regional centers out in the community closer to where patients live. That's so important for cancer patients that tend to be fragile. It's very critical that they have access to their oncologist nearby for same-day appointments and easy access for visits. I think that there are barriers that community oncology clinics face, and it's primarily a lack of understanding from policymakers about the value that community cancer centers provide and the resources that they need to continue to operate. Some of the key issues in terms of the problems with the payment model is that certain settings get paid more for doing the exact same thing compared to community oncology clinics for no reason at all. That anybody provides the same level of service really should get the identical reimbursement. If an insurer came to our clinic today and asked us, how are you doing taking care of patients? We would say, we're doing great. Our patients like us. We give them good care. We give them what they need, no more, no less. We work hard to keep them out of the hospital and keep them out of the emergency rooms by providing same-day access. But if an insurer asked us to prove that, we'd have no way of doing that. We need to build metrics in the system so practices can demonstrate how well they do. Oncologists spend 10 years training to learn their area of expertise, and it makes no sense after making that huge upfront investment to leave it to politicians to decide their futures. I think every oncologist should make it their personal responsibility to become advocates for their field. I think that we can advocate for anything that promotes value and quality for our cancer patients, such as furthering the medical home model. I think oncologists can create the future that we want to have.